Savelai, namaste, good morning to all. Look taller yes, I think it looks sound good. After what all has been said so far, there remains very little for me to say. But in preparation for this conference, I worked out something that I would like to share with you all about this explosive technology, now I would call it, which belongs mostly to this generation. At 85, my time has ticked away. But I am here all the same to learn from most of you. I still read a lot of articles about AI, as I do about people who are opposed or have been sounding caution. AI, to me, it touches all aspects of human endeavor. Name it, and it's there. Business, arts, health, and it has immense potential to redefine our lives, how we live. Questions like, the question, I came across a piece which asks, is AI making mothers obsolete? Now those are questions which are no longer science fictions, but intriguing debates as explored in Helen Phillips' new novel in a dystopian world, which was environment was destroyed and people were hiring empathetic robots. This subject of this conference was related to health, so I will, and so much has been said that I don't think I could really add to this one. And everything has, what I had noted is already on there. Now, one area of where AI has been applied most is healthcare. I didn't enumerate the list because Dr. Prajwal did that already for me, so I won't go to that again. But nowhere this impact is seen better and more profound than in healthcare. Therefore, there's no wonder that about 1,000 strategies, some tech giants were mentioned, I'm not mentioning those, and see how that money is being poured into AI and will continue to be poured in. I want to talk about startups. There are over 1,000 startups working in health AI. According to a recent analysis by Flare Capital, $23 billion have been raised in the last 10 years. The biggest chunk of half of that has gone to clinical care. So, and you heard a lot about that already. And this word transformation comes very frequently. I was very happy to hear from Dr. Ada that this is not the first transformation that human beings have made. As he said, the steam engine was first, and there were subsequent ones. The way, I have noted revolutionizing AI, but I will not be using that word very frequently, transforming lives, The AI offers unprecedented promise and we need to be careful, promise and perils of AI. Again, that has been talked about several times during this meeting. We need to be very careful about it. Anyway, to talk about my own journey with AI, it all began in 2020 during COVID-19 pandemic. We were trying to reach our patients through telehealth, and we had some success, and we were just wondering, could AI be helpful? The AI was not talked about much in those days, as much as it is talked today, as evidenced by the gathering here. And so, with the now supported by a US-based charity called Direct Relief, many of you may have heard, it's a very reputed organization, listed both by Forbes and Direct Relief, and working with our colleagues NAMI. Now, if you translate that word NAMI in Nepali, it becomes famous, well-known. So we're very, very happy to have partnership with NAMI. So we made some progress in that area. And the area that we worked at that time was two major causes of blindness. Diabetic retinopathy, diabetes was mentioned somewhere along this presentation, and glaucoma, which is the second commonest cause of blindness in the world. And the third one was something which makes people deaf, and that's the commonest cause of deafness, otitis media. So having made some progress, we have now embarked on, again, some of the things have been already talked about, a common cancer in this part of the world, particularly in Terai region, where tobacco chewing is a major problem. And for this, we are working with, again, NAMI and us are working together, but we also are working with two medical institutions, one in the east, that's the BP Koirala Institute of Health Sciences in Dharan, and another one in Birganj. I would like to request these two gentlemen from Dharan and BPKIS to show up so that people know that you are here and they can come and we're also, thank you, we're also working on congenital malformations. And for this, we are again working with Nepal's first genetic clinician, Dr. Arati. Is she here? No, okay, she is not here. And so that's what we're doing. And remember this word collaboration, cooperation was mentioned several times. It's not something that a single organization can do on its own. So we need to collaborate, and that's what we are doing. Again, these challenges have been mentioned many times, and I don't think I really need to elaborate on that. One of the challenges is, all right, we're doing some very well, in terms of diagnosis, treatment. Now, what if treatment fails? We're not able to do anything medically. So, we have a small community hospital, which is a specialty center specializing in vision, hearing, and oral health. And we are now working on that cancer that I mentioned to you. We are working because we had our community center deals with those three problems only. So, and so we are also learning how can we use some of these developments for these children with disability, blindness, deafness, or autism spectrum disorders. Now, autism is increasing, I would not say as fast as AI, but certainly faster than anything else. And there are very few centers providing services. So we are also working on that and trying to use AI in that. Now, you may already be wondering, what are these guys doing? Medicine fails. But there is something that we can do. None of these disabilities is end of the road. Just a bend in the road. You still can do things for other people. So you may be wondering that you're using it for everything, and as if it is Maslow's hammer. The famous saying of Maslow is, if you have a hammer, every problem is a nail. We're not looking at AI as Maslow's hammer. We are very selective, in fact. Now, and the last point that I want to make is the group that is assembled here, and I met several of my previous students here, and one I also see Dr. Arjun sitting in the middle. Although he is fairly advanced, but still young for me. So I just want to share with this. Be an enthusiast about AI, but don't be carried away by it. There are people, and it's of similar age as some of the younger people that I met earlier. Yuval Noah Harari. He has made a name for himself already. And he's published many books. He is the most sought after speaker in the world. He travels all over the world. And some time ago, he just very recently, he made a statement. And there are two statements that I would like to take out from him. Number one is, there must, for all the problems that has been mentioned, there must be a regulatory mechanism for AI. So we must have a regulatory mechanism for AI before AI takes measures to regulate us. See, the problem is the word tool is inappropriate in his thinking. Tool is something that you use. AI is something progressively it has become autonomous. We do not know which way it's going. Therefore, he calls it agent. An agent can do several things, which a tool cannot, because the tool has to be handled by an agent. Therefore, that's one thing that I would like to mention, that we need to be very, very, very careful about. Okay, I think the bell has gone. I still have time later on. I can... Okay, no. Okay, so I have some more time. I think I'll end at this stage because I have an opportunity to say again, but some of these presentations that I heard have been very, very educative, illuminative, and Rosalind's pyramid is something that I love. We tend to jump onto the the last point before the starting point. Let's keep our feet on ground and aim very high. Now, aiming for the sky is not enough now, because we're already going into the outer space. So aim very, very high, higher than sky, but have feet on the ground and keep in time with the changing times, because things are changing very fast. The world has become very difficult, very unsafe actually to be in one of the studies that an insurance company did. This, I think, is a Swiss insurance company, Exiata it's called. People were asked, what are you most concerned about in this world, in the present world? The answers were climate change, successively for 3 years, geopolitical problems, and disruption, possible disruption to be brought about by AI. So AI is humanity's best hope. I mean, that's what it looks like listening to these presentations. But it is also humanity's worst fear. So, promoting help and reducing anxiety. Mental health are increasing without AI, but the good news is mental health can also mental health can also be helped by AI. So with that, I'd like to conclude and say thank you very much for this opportunity, and we will like to invite the panelists. Oh, all right, and then see.